What does APGAR score 6 at 1 minute and 9 at 5 minutes? Are there chances the newborn will grow without long-term effects? That was a question that was left on one of my recent videos, and I want to speak directly to it because I know how many parents are trying to make sense of these numbers after hearing that their baby may have suffered an HIE brain injury at birth. APGAR scores are often one of the first pieces of information that parents will hear right after delivery. And those numbers can stick in your mind, especially when the doctors are later talking about a brain injury and they're looking at imaging and they're talking about the possible long-term effects of everything. So let's take some time today and let's talk about what these scores actually mean. The APGAR is a quick assessment that's done at 1 minute and 5 minutes and sometimes 10 minutes after birth. And it looks at 5 things, and that's going to be the heart rate, breathing, muscle tone, reflexes, and skin color. And each gets a score from 0 to 2. The numbers are then added together and then they give you a total out of 10. So if you've got a score of 6 at 1 minute, that means that the baby may have needed a little bit of help starting out, or maybe some type of stimulation or some type of support with breathing. And that's not uncommon. And when you see a 9 at 5 minutes, that's usually going to reflect that the baby was improving. It means that the baby is responding and they are adapting to life outside the womb. So on the surface, these numbers may seem reassuring, and they can be, especially when the score is making improvements like what we're seeing in your question. But from my experience as a birth injury lawyer, I've learned that APGAR scores are just one piece of the story. They're helpful when it comes to these types of things, but they are also extremely limited. The first thing is that the scoring in the APGAR is very subjective, and that means that a different provider might score the same baby a little bit differently depending on what they're seeing in the moment. And the APGAR doesn't explain why a baby may be struggling. So, and it doesn't tell you if there is a problem during labor or whether the brain has suffered any injury. It's more of a snapshot than a full report. Medical guidelines, including places like ACOG, they'll tell us that a 5-minute APGAR score of 7 or higher is generally going to be considered normal. If the score is below 7 at 5 minutes, that might lead doctors to consider whether an HIE event happened before delivery or whether the baby is going to need more support after birth. But even when the 5-minute score, even when it looks good, that doesn't always rule out concerns. Sometimes other things can emerge later on, like seizures or low tone or abnormal imaging. And that's why the APGAR scores are just one of the factors that doctors are going to consider when evaluating the baby's condition. In legal cases, we look at the whole timeline, and that's going to include the fetal monitoring, the delivery notes, the cord blood gases, and any other types of resuscitation efforts. But when it comes to understanding your baby's long-term outlook, that's not something that the APGAR scores alone can answer. The truth is this: the best people who are equipped to assess how your baby is doing are the medical professionals who are following your child closely. They have access to the full medical record, they can see the imaging, they can track how your baby is responding over time, and they're the best ones they're in the best position to talk with about what your baby's future might look like. I know all of this is hard because I speak with families across the country who are trying to process all of this while they're still in shock from the initial diagnosis. And sometimes it can take time to get answers. So if you're watching this and you're trying to understand what happened during your baby's birth, just know that it's okay to have these types of hard questions with the medical professionals. It's okay to want clarity with everything. Again, I'm Marcus Boston, and if you have any other questions about your baby's HIE brain injury at birth or potential subsequent CP diagnosis from a medical legal standpoint, don't hesitate to reach out and contact me. You can find out more information about me in my profile, or if you are on certain apps, you can send me a DM, and we can chat a little bit back and forth about your baby's story, or you can just wait and watch the picture that follows the end of this video. All right, that's going to be it for today's quick educational video. Have a great day, everybody.